Hello and welcome to the Grounded Awakening podcast, conversations connecting science and intuition. Real life lessons from real people, real professionals who've had experiences that help them awaken to the truth of what they need and what is needed to thrive in their profession. These are conversations to help us evolve and awaken to what we need to be grounded yet spiritually awakened in life, in parenting, in education, in healthcare, and in the way we interact with the world around us. We hope to ripple change through awareness and by helping people connect with their mind, body, spirit, one conscious conversation at a time. And welcome to the Grounded Awakening, where we are going to have a fabulous conversation today about chronic pain. We're going to talk about the science of chronic pain, but we're also going to talk about the intuitive healing aspect of chronic pain and managing chronic pain. So I am really excited to bring my guest, Elizabeth Kipp, on. Elizabeth is a chronic pain specialist. She's a yoga-informed addiction recovery coach. She is an ancestral clearing practitioner, a yoga and meditation teacher, an international best-selling author of The Way Through Chronic Pain, Tools to Reclaim Your Healing Power. She focuses on helping people realize the power of their inherent healing. Elizabeth healed from over 40 years of chronic back pain, including anxiety, panic attacks, 32 years of addiction to prescription opiates and benzodiazepine medication. It's a big issue with chronic pain. I'm sure we'll touch on that. She now works to help others achieve the same healing that she experienced directly from the work that she teaches. In addition, Elizabeth offers one-on-one and group sessions in stress and chronic pain management and addiction recovery, ancestral clearing, trauma-informed yoga, and meditation. Find out more about Elizabeth on her website, Elizabeth-Kipp with two P's, KIPP.com. Now I'd like to welcome Elizabeth Kipp to the Grounded Awakening podcast. Hello and good morning, Elizabeth.
Good morning, Jennifer. So glad to be here.
I am so excited to talk about this because it's interesting. I teach a course called Holistic and Complementary Approaches to Health and Healing, and we just covered the mind-body connection to illness. And we talk a lot about the differences between Eastern medicine and Western medicine, not shaming any, because I am a true believer that we do need an integrative, complementary blend of the two. Myself, my son had cancer, and I used the chemotherapy and the Western medicine. But in addition, I used complementary and alternative medicine like Reiki and nutrition and herbs and mindfulness and guided imagery, all of that. So this is a topic near and dear to my heart. And I'd love to hear about your own grounded awakening. How did you come to this path, if you will?
Beautiful. Thank you. Love the question. And it's so important, this integrated approach.
Yes.
I have a science background, so I started out really getting trained as a basic researcher, but from a biology point of view, I studied, well, I have a degree in plant science, but I had a lot of physiology, human physiology, studied animal behavior, ecosystems. So I kind of had a broad brush around that. And when I had this problem with my back, I had an old injury that became unstable in my back. I had an old break and it became unstable, and they were worried that I was going to end up not being able to walk. So I had to have surgery to stabilize the spine. Mm-hmm. And my pain got worse after the first surgery. And then they said, oh, we have to do another one. It was a spinal fusion at the base of the spine. Oh, we have to do another one, second surgery. And after the second surgery, I was even more pain. And I remember hearing the doctor say, you will be in level 7 out of 10 pain for the rest of your life. And you will be in a wheelchair when you're 40. And I was like devastated when I heard that, because I actually in that moment was very vulnerable and believed him. But there was a part of me inside that was like not buying that. but most of me was like, oh my God, this is my life. And I kind of got stuck in that space for about 2 weeks. I couldn't think straight.
Yeah.
And I was in a
You
really
weren't
dark
given any
place.
hope. You were not given any hope and
Yeah.
allowed. There was no space for you to think of something else and another alternative. You were given the worst case scenario.
Well, not
Try
in
it.
that moment. There wasn't. That's exactly right. There was no
Mm,
room for hope, which was an error on his part.
absolutely.
Anyway, so after 2 weeks, I'm like, I knew there was a solution. I couldn't find it. And
Yeah.
finally, after 2 weeks, I found the solution, which was that doctor is not a fortune teller. He's operating in a scientific paradigm that, by definition, is limited in its view. Science can't discuss anything that it can't observe, measure, or describe. So he's operating in that paradigm. But where do we live? We live in the all that is. We live in the part that science can observe, measure, and describe, and the rest of it. And where does healing happen? It happens in all of it.
Yeah.
So I realized that was an error on his part,
Such a
his
great point.
limited vision. And he was very insistent on that. The other thing that I felt he was in error about was science. He forgot his basic science, which is everything is a probability. It's not facts, black and white. It does not the way it works. It's all probabilities. So he should have said, it's probable that.
Mm. Or
you
it's
know,
possible that,
there
yes.
was no room for hope. And that was also an error. So I feel like my scientific background saved me because I was taught science on such a basic level that I was always taught, what are your assumptions? So I looked at the assumptions, and the assumptions were so like, oh, he's forgotten, right? And so I was like, I'm going to look beyond the Western scientific model for my healing. And that was the awakening. Um, I also always had a sense of, um, something greater than me was kind of at play, and kind of organizing principle, general organizing principle, and I've always learned to bow to that, and I always kind of felt held by that, um, and so I I kind of looked in that direction and said to it, you know, what am I missing?
Mm,
What am I missing? And that really helped me move forward. It took me a long time to find a doctor that really understood chronic pain, but that piece that I just talked about, that path that I laid out, that was laid out in front of me, really, um, that was there, and that was my. It was the light that took
yes,
me to this guy, to the
yes.
guy that finally helped me heal my chronic pain.
That's incredible. I mean, everything that you're speaking of is really talking to me. My big thing is about hope and healing and being open to the possibility. And my own awakening had to do with, like, to your point, that our science is about probability. Science tells you this is what we know, this is what we've experienced, but it's our job to find that hope and find that light, because that hope is what's going to shine a light in the darkness for us. It's going to help mark our path to keep taking steps forward, to be open to the possibility of a different outcome, of more. And I love everything you said. I was jotting down little things as you had so many yummy nuggets
Mhm.
that you talked about, as far as, what are your assumptions, looking at your assumptions, because that creates bias in the way that we view things.
Absolutely. The other piece was, pardon me, I love working on the edge of the science paradigm. That's where I like to work. And that was what appealed to me as being a basic research kind of person. And so I'm thinking, what paradigm is this guy operating under? Right? What paradigm, the current people that are looking at chronic pain, what are their assumptions? And you know what his assumption was? His assumption was, um, he never asked the question, Why isn't Elizabeth healing? He made an assumption that I wasn't going to heal.
Right.
And so how does a patient even deal with that
Absolutely.
when that's the underlying assumption with the doctor in front of you? Now, this is the way I say it because I work with people all the time in this area, kind of like mindset and
Mhm.
kind of how to navigate the medical space.
Yep.
Understand who you're sitting in front of.
Yep.
It doesn't matter whether it's a Western doctor that's, trained up in that model, or an Ayurvedic practitioner, or an acupuncturist, or a Reiki, or ancestral clearing, whatever.
Right.
Understand what's their perspective,
Yes.
and what do they have to offer you, and then what are their limitations. And all healing modalities have something to offer, but they
Mhm.
also have a limitation because they're operating under this their own paradigm. Now, the beautiful thing is paradigm shift. So we just have to kind of be humble and understand that where we're operating now is not necessarily where we're going to be operating in 2 years or 10 minutes or 10 years from now. Right?
Right. Absolutely. And it's interesting that you say that because I'm married to a surgeon. I'm married to an orthopedic surgeon. And one of the things that our experience with our kids and our own we both had our own grounded awakening as far as understanding the science, but really having that aha moment of, wait, but there's more. And that this perspective, to your point, is limited. And it really helped us open to the possibilities of more and the bigger picture of, okay, what is the lesson in this? What are we supposed to learn? What are we observing? What are we learning? What is our own kind of scientific experiential happening, right? And it's really changed the way he approaches patients. It's really um, changed the way that he has conversations about pain with people. He has really embraced the aspect of the mind and the power of the mind for health and healing. And he did a study on opiates and how many for prescriptions, how much pain are people in post surgery, how many pills do they require, where is their most amount of pain. And so he and his colleagues really did look at how can we manage pain to get people through, because pain can be a limiting thing as far as limiting the ability to move forward, limit the ability for functioning in your daily life. So he wanted to look at, and I think this is where a lot of physicians and practitioners struggle, is their intention is to help people be free of pain and move through pain. And the only way some of them know how to do that is through opioids and narcotics. And so they prescribe them. And then there's trusting the patient to know what they need. So when the patient comes to them saying, I'm in so much pain, I need more, they're not always looking at the big picture here of, okay, is it that you're escaping from something? Are you doing your work to move through this? And all that. So it's funny because he's not very popular with the patients that are wanting to escape and wanting more. He really says, I want to get you through the first 28 to 48 hours. And then after that, I will help support you on alternative pain management. So I'd love for you, because chronic pain is probably one of the most challenging things that physicians and healthcare practitioners face. It is one of the most challenging things that people face to be dealing with chronic pain. So can you talk a little bit about and educate my listeners about the difference between chronic pain and acute pain and how that kind of manages your daily life?
Absolutely. And thank you for the question. It's so important.
Yes.
Um, Acute pain is what we feel after a trauma. And this is the area that surgeons know well, and what they're so good at, right?
Yeah.
Opiates are appropriate in that space if the patient is so stressed out that they can't sleep,
Yes.
because we heal when we sleep.
Right.
Now I'm just going to
Great
say,
point.
I'm going to make a point here. This is not about how cool Elizabeth is, because it's not about that.
Mm-hmm.
But I'm going to say I broke my wrist, my forearm up here in 7 pieces about 2 years ago. Now, the interesting thing about that accident was when we saw the X-ray, the blessing was all those bones broke in place. So all we had to do was put a splint on.
Oh,
We
good.
didn't,
Yeah,
have to put
yeah.
pins in or any of that, right? Just but it was very painful. And they said, here's a prescription for Percodan or whatever it was, some kind of opiate. And I was like, man, I'm in recovery from that stuff. And they
Right.
said, well, you're going to feel worse by midnight, and if you come back, we're not going to give you a script then. And I was like, okay. So I took the script and I filled it, and I went home and I practiced the tools that I write about in my book.
Mm-hmm.
Right. And I never took an opiate. Now, I've also had a kidney stone that was about 4 millimeters, which is fairly
It's a good size
significant,
kidney stone.
right?
Yeah.
And I needed a shot of Dilaudid for that, like in
Yeah.
the emergency room. But
Yeah.
I only needed one, which is kind of interesting, right?
Mhm.
And then, I used some mental things.
Right.
So acute pain is needed to manage a patient when they're so stressed out that the nervous system just can't rest. It's really important that we have them, because the body goes into shock, and
Yes.
this is not what we're going for. So
Right.
now chronic pain is any pain that's felt 15 days out of 30 for 3 months or more. Any pain, physical, mental, emotional, spiritual, financial. The brain can't tell the difference between a broken bone and a broken heart.
Right. It becomes an ongoing stressor. Yeah.
It's an ongoing stressor, and it fundamentally changes the way the brain operates. We get chaos in the brain from that. We have a misunderstanding of where the actual pain is coming from, because at this point, if it was in my back, it's not coming from my back, it's coming from the brain itself.
Yeah.
And there's an increased negative bias. We already have a little bit of a bias anyway to the negative in the mind, but
Mhm.
it gets much accentuated in chronic pain. So it's like blaming other people and then blaming me, and there's just all this, I can't, it's a very tricky mind space. So here's the thing: opiates do not help heal the changes that happen in chronic pain in the brain.
Right.
Opiates, and there's another reason why I didn't take that opiate. I asked myself, what would it accomplish? Because I'm not in shock, and I actually can sleep because I'm going to meditate.
Mm-hmm.
And what meaning am I making of that pain? Right. So an opiate represses the respiratory system, so you don't breathe well, and you excrete 70% of the waste by weight in the body comes out of the breath. So you're not able to, if you're taking an opiate, you're not able to do that.
Mm-hmm.
If you're taking an opiate, it paralyzes the digestive system, so you can't absorb properly, right?
Mm-hmm.
Nutrition, and it dehydrates the body. So now you're not getting enough nutrient, and you're not getting enough water. And how is the body supposed to heal in that environment? Right.
It just blocks the pain receptors is what it does.
And it does, but it also blocks the emotional.
Right. It's not selective in what it's blocking.
Yeah. And so it's a handy stopgap measure.
Mm-hmm.
But it's not meant to be taken over time. And I don't know of any studies to this date where it says opiates have actually helped heal chronic pain. I don't know of any out there, and I've kind of looked. So I'm like, how is this helping me? So when I hurt my arm, I was like, wow, why is this going to help me? And I just realized that it wouldn't. Now I'm in recovery from fentanyl was one of the opiates. I was on 15 years of fentanyl, which is amazing.
Wow.
high doses of it too,
Yeah.
and benzodiazepines. And I actually fractured my T9 vertebra a couple of years after I heard this. And I have osteoporosis from all the medicine I was on, right?
Oh,
Which you can imagine. But we're
right.
working on that.
Yeah.
We're
Yeah.
using alternative things to work on that. But
Right.
they wanted to do this thing called a kyphoplasty, which is where they kind of put human glue. They shoot human glue into the bone that was broken. So they and I was like, okay. And we went into pre-op, and he's like, we're going to give you fentanyl and Versed which is a benzodiazepine,
Right.
to
Relaxes you. Yeah.
to keep you, to get you through this procedure. And I'm like, wow, I'm in recovery from all those things. And we
Right.
don't have to give it to you. And I was like, wait a minute, you're going to
Yeah.
take me from zero to needing fentanyl, and you're not going to give it to me? I said, don't give me any after, right? Just don't
Yeah.
give me any after. So, and I was fine, and I was concerned
Yeah.
because people relapse, and I'm an
Yeah.
addiction recovery coach, and relapse is a
Yeah.
thing. And I was like,
Yeah.
oh man. But it was beautiful. I went in there and I used my meditation,
Yes.
and I just stayed in the moment. I
Yes.
just stayed in the now. And we got through that procedure, and because it's done, you're awake when you do it.
Yeah.
And then when the procedure was over, you know what I did? I stayed in the now. I didn't start fretting about, oh, I'm going to
Right.
relapse. And I
Right.
didn't have, the body wasn't looking for there was any craving or anything.
Yeah.
It's like, what meaning are we making of our
Right.
experience? That's the thing.
Yes. You know what's incredible? And I was just sharing this with my students about the in the operating room. There have been studies shown about certain healing music played during the operation and how it can actually lower the requirements for the anesthesia. It can actually reduce the amount of medication needed, like the Versed and the fentanyl, to help with relaxation. It's pretty powerful. There are a lot of alternative things that we can do, and I feel like there are practitioners. I know my husband, and I know several medical practitioners that look for the alternatives. They look for things to reduce the amount of medication and opioids and more invasive things that are needed. So, I mean, I know for myself, and it sounds like you as well, I look for those practitioners that are going to listen to me, that are going to help me navigate through my challenges, my illnesses, or whatever it is that I'm faced with, that ask me the right questions to look for the root cause instead of just throwing a quick fix to make the symptoms go away. And I feel like, yes, I am a medical practitioner. My background is critical care nursing. I'm a medical practitioner, so I do have that knowledge. But I feel like anybody and everybody, when you learn to get tuned into who you are, what you need, and understand when your body is a little bit out of balance, you can absolutely be that advocate for yourself and find the people that want to co-create with you and want to be the partners with you in your own care. So I'd love for you to talk about your ways, like what are the ways that you were able to manage care, and when you say you found the right practitioner, what did that look like? What did that take for you to find that right practitioner?
Well, I had a yoga teacher who kept me limber.
Okay.
And I did very specific yoga because my back was such a mess. But I had a yoga teacher that kept me limber for
Yeah.
20 years,
Hmm.
until I finally found Dr. Prescott. Um, I massage. I had massage once a week, and I
Hmm.
had acupuncture once a week.
Awesome.
So those were things that kept me going. Also, I had a meditation practice. I've been meditating since, like, I don't know, 1975 or 6. So
Hmm.
I had a meditation practice, and I started talking to my body. Um, Oh gosh, I don't know. At some point, I had a lot of surgery. I had 3 surgeries on my spine to stable. It took 3 surgeries to get it stable, and then I had a 4th surgery, kind of a corrective surgery, and 3 times they carved on the back of my hips to take donor bone to put into the fusion, and those the back of my hips just were just. they were just that level of pain was pretty intense. And I finally got to a point where one day I was like, I'm going to start talking to my hips. I'm going to they're never going to get carved on again. And I sat and in my meditation for 20 minutes every day for 9 months, I said, I just did this mantra, or something. It was 8 months. I'm not going to hurt you again. That's what it was. And it was really interesting because I discovered that it wasn't really just physical pain. I had discovered that this was psychosomatic, this pain, because my yoga teacher had me get on my belly and she asked me to raise my leg up towards the ceiling just a little bit. And it was so painful. I was like, I can't do that. And she said, well, why don't you just imagine activating the muscles? And it was just as painful. Oh, sorry. Yeah. And just not even get it off the floor, but just activate the muscles. And yes. It was just as painful. And then I imagined doing it and the pain was exactly the same. And I was like, oh, this is not about lifting my leg. Right. This is about the mind. Right. And this is before I understood that chronic pain changes the brain. I didn't know any of that. And I went, and this is why I did that meditation. I just went in and I repeated that. And I did it 20 minutes a day for 8 months. And then I was able to raise my leg. Whoop, no problem.
Wow. Well, it's the power. It is the power of the mind. But I mean, I know when my son was going through chemotherapy, I remember he was septic. And the mind is also a powerful thing as far as imagery and doing guided imagery. I remember doing Reiki on him. My dear friend Bonnie said, gave me a visualization to do. And I literally was doing Reiki on him and I was imagining raking out the infected tissue and just raking it out. And then when he was third spacing, because he got septic, his body was like puffed up like a tick, I say, because what happens when you get septic is your blood vessels no longer it's like you're so out of balance that the blood vessels start to leak fluid out to the tissues and it doesn't go into the where the channels that it's supposed to. It kind of leaks out. So he wasn't, diuresing or peeing like you should have. So I remember doing Reiki on him and visualizing his blood vessels like sponges and or straws, soaking up all the fluid and bringing it back in. And literally within about 24 hours of doing this, and I did it all day long, he started to diurese and he started to, get some of that fluid out. So it is pretty powerful when you work energetically and you're gentle with your body, you're kind to your body, you nurture and you connect to your body. There's a lot of power in that I think people don't realize. And I think, unfortunately, when you talk about the chronic pain, to me, I mean, my big thing is the stress management. I have a course called Stress SOS that I'm about ready to launch. And it's really when people are in that fight or flight, your muscles tense up, your whole body tenses up. You don't know how to relax. You're so disassociated with your body and with what's happening that you think, oh, I am relaxed, but you're not, or I am activating this, because you're also projecting, knowing that, oh, but if I do this, I'm going to have this pain, or if I do this, I'm going to have this result. And you start to project and kind of go down that, I call it that stress spin, where it's like a tornado. You're just picking up collateral and adding to the stress. So that plays a huge role, I would assume, in chronic pain and managing chronic pain, because of the stress aspect of it, what it does to the brain, to your point, what it does to the body, what it does to the mindset. And so a lot of the techniques that you're talking about that you're doing, I mean, aside from acupuncture absolutely can help with rewiring and the energy channels. And acupuncture has been shown to really help with pain. But the guided imagery, the meditations, the mantras, the breath work, that's all stuff that also helps with stress.
Exactly.
So, yeah. So when you say, I remember when we were talking, you were talking about how the healing power lives within us. Can
Hmm.
you talk a little bit more about that? Again, I think about so many of us hand over our health to somebody and say, here, fix me. But there's only so much. And I think that's why a lot of practitioners feel like I have to give you, first of all, because of the legality of things, I have to tell you the worst case scenario because I am bound to tell you the worst case scenario. But I think it's important to all you practitioners listening, make sure that you offer the possibility of hope and you offer alternatives. You don't say it like it's a fact. You say it as there's a high probability, but you can certainly leave space for hope and healing in that discussion. So, sorry, please let me know or let us all know what do you mean by healing power lives within you?
Yes, so important.
Yeah.
We're at war with pain. This is the thing, as a child growing up, one of us would fall down or bump our head or whatever, and what would happen? The adults would rush, would not walk, rush,
Right.
right,
Yes.
to the scene and do whatever they could to stop the pain immediately. No one ever said to me, pain is part of healing.
Right.
So we're in this rush to get rid of pain. Pain is it's part of how the body heals. So fundamentally, we need to change our mindset right there. I'm not here to help you get rid of your pain. I'm here to help you make peace with your pain because your body knows exactly how to heal. Doctors can set a bone and stitch up a wound, but they can't tell the body how to heal.
Right.
Health practitioners can, including doctors, of course, can help you set conditions
Mm-hmm.
for optimal healing, but they can't tell the body how to heal. So, what are our assumptions? Our assumptions are not the doctor knows how to heal my body.
Mm-hmm.
No, the body knows how to heal. The doctor
Yes.
knows how to set up optimal conditions for you, right?
Such a great point.
Based on their perspective. The
Right.
acupuncturist has a different perspective. They'll set up a different set of conditions. The Reiki practitioner brings in a different perspective, right? So here's my thing. I had to break this down for myself to get it straight because of the way I was raised, right? I give the entire medical community 20% of the responsibility for my healing. All of that, right? They give me orders. I go to a physical therapist, or maybe a mental therapist, right? We work with their stuff, right? And I take that and then I go home and I work with it, diet, all of it, right?
Mm-hmm.
80% of the responsibility is between me and this force inside that knows how to heal. So my job as the patient is to take all the orders that the healthcare world gives me, take them home, apply them, and then get the hell out of the way and let the body do the healing job.
I love that. I love that. I mean, it's funny because my practice changed because I used to see people and people would come to me for holistic things, some energy work, some nutritional counseling. And I realized, you know what? People are still coming to me wanting me to fix them and not necessarily following through with the things that we discuss as far as what they can do. Because guess what? You have control of yourself and only yourself. You can control your choices, your thoughts, your actions, your reactions, and you only in the present moment. But so many of us focus on the future or hang out in the past.
Mhm.
We attach to beliefs. We feel powerless because we're giving away our power to other people. And that is what you just talked about is the Eastern philosophy on healing, which is, and even osteopathic medicine, the foundation of it, unfortunately, has become very westernized. But the foundation of it is the body knows how to heal itself. You just need to realign it or create the conditions to let it heal in an optimal setting. But when you were talking about pain and how we are conditioned to rush to get out of pain, it makes me think of, even when you're not talking about chronic pain, even emotionally with the mental health crisis. So there's a chronic pain and opioid crisis, chronic pain management crisis. There's also a mental health crisis, I believe, in the country. And I feel like, yes, we are conditioned to avoid discomfort. We are conditioned to run away from pain and discomfort, whether it's physical, whether it's emotional, spiritual, and to hurry up. And that's where we get that distraction, that looking for things to distract us from what we're thinking and feeling. But unfortunately, it's created this disembodiment, this lack of grounding, this escapism in our country. And that's why we have the opioid crisis. That's why we're looking to other people to fix us, because we don't want to take responsibility. We don't want to sit in our discomfort. But again, to your point, that is where the healing happens. That is where the greatest healing happens, when we are able to sit and almost like make peace with that pain and with that discomfort, and get to the why behind it, get to the message and the lesson behind that. I love that, what you just said. So
Exactly.
yeah,
I'll just say, I do a meditation. Like I said, I've done meditation for a long time.
yeah,
But here's the challenge in meditation. The challenge is the thoughts come in and they want to grab your attention away
yes,
from whatever you're focusing on in your meditation, and that can become that's the thing.
yeah, the
What's
popcorn thoughts.
interesting is what's interesting is where is it that the mind, that the brain is doing the rewiring? Oh, I'm bored of this meditation, I'm going to get up and walk away. Well, you just gave up the opportunity to rewire your brain when you did that. Because in meditation, when it gets tough and you want to get up and run away and say, I'm done with this, that's when the healing happens.
Right.
That's when you
That's the
start
magical
rewiring.
moment.
Yes, and that's when you rewire the brain and grow your capacity to be uncomfortable.
Yes.
Because it's not
Yes.
about not being uncomfortable. It's not about that. It's about growing your capacity to sit with the discomforts that life brings. It's part of the challenges of being a spiritual being in a human body.
100%. It's funny, I was thinking, just when you said that, I was thinking about, I was at a yoga class and I was in this pigeon pose for the hips, right? The hip, big hip opener. And I'm very flexible, but as a woman, as a mom, I carry a lot in my hips. And so I'm in this pose, and this particular instructor loves to hang out in this pose. And so I'm there, and my practice is to breathe, to kind of notice it, to breathe, not to push myself into it, but to ease into that pose, and then to find that moment, which my dear friend Manuela calls the edge. That moment where you feel like, oh, okay, I can feel that. I'm starting to get a little uncomfortable here. And then hang out there instead of backing away from the discomfort so you don't have any discomfort, or pushing through the discomfort to the point of pain. Hanging out in that edge of pain and discomfort, and sitting there and breathing into it. And as I'm sitting there and breathing into it, my mind's wandering. I hear the spin class going on next door, the bumping of the bass. I can hear the kids playing. My head starts to my mind starts to wander as far as, oh, I really wish there was music here. Like all the things that are not optimal that I want to be optimal. My brain starts going there, and I catch myself. And that's where, even as a practitioner, when we're doing this regularly, we still have to have those moments of, okay, your mind's wandering, Jen, bring it back to the breath. And I remember sitting and literally breathing into my breath, noticing that, and then wanting to run away from it, wanting to get out of the pose. My mind going, okay, how much longer is she going to have us sitting in this pigeon pose? But I thought, okay, if it's check in with my edge again. Am I in the pain part, or am I at that stretch? And then how can I breathe into it to relax the muscles a little bit more? And it really was a practice on sitting in that discomfort and allowing your body to work through it so it can start to release a little bit. And it's funny because I remember that moment thinking, okay, this is how you find calm in the chaos. This is how you find that inner peace within all the stuff that's swirling around you. Because I can't control the bumpa in the background of the spin class. I can't control how long the practitioner is going to tell, or the yoga instructor is going to have us hang out there. But I can control how I'm responding and reacting to this moment. I can control my breath. I can choose to back off if I need to, and then come right back into it. So I love that. What can you offer our listeners what would you say are your top tips for managing your pain, your chronic pain, naturally?
Well, the first one is to understand the breath, leverage the breath, the conscious breathing, learn how to. You really need to get with somebody that understands the vagus nerve and how to use breath work to calm it, because in pain, the vagus nerve is the 10th cranial nerve, and it touches into all the organs, up in the face and the neck and the ears, and it's the heart, including the heart, one of the organs.
Yeah.
So our
and it gets activated with
yes,
stress.
it's our threat assessment system.
Yes.
So when we get in a pain situation, obviously that goes on alert, and
danger, yeah.
and you can hack that.
Mm-hmm.
So in chronic pain, it gets dysregulated,
mm-hmm.
and so you can use the breath, long, deep breathing in and out. Don't hold the breath, just nice and a nice round breath. Right? We don't want to hold the breath when we've got a dysregulated nervous system. Just in and out, nice and long, and keeping them in the inhale and the exhale even in length and duration to one another. 3 minutes of that, and your nervous system, that vagus nerve, is going to go, oh, I'm safe after all. And it's going to relax, and you'll go right back into the parasympathetic, right? You'll be then that rest and digest part, which is where we heal. So number one, learn how to leverage the breath. Number two, what meaning are you making of this moment? What meaning are you making? Oh, I'm not going to get better. Oh, I remember when this happened back then and I had to go and do this. Where's the present moment? Right? The present moment is right here. And I'm as guilty as anybody else for doing what I just described.
Right. So when you say what meaning are you making, you mean don't project to the future, don't go back to the past, but really be in the present moment.
Well, I'm ask yourself, what meaning are you making of what's happening right now?
Yeah.
Oh, pain is bad, right?
Okay.
Oh, that's a problem.
Yeah.
Now you're in a war. Not only is now you've actually had a thought that's going to dysregulate the nervous system. It's going to actually, put that vagus nerve into fight or flight, because now you're doing this. You're in a fight with pain. Right. So what meaning are you making? And the other one is the third one, which what you're talking about, is where are you? Are you in the past, the present, or the future?
Yeah.
Because where does healing happen?
In the present moment.
It happens in the present moment. It can't happen in the past because that's done. The future hasn't happened yet. Right. It happens here. So what we do in this present moment is really key, and we have to learn how to milk that. When I learned how to stay in the present moment, it was a practice. I had to practice doing that. I still work on that.
Me too.
After all this time. Yeah. The thing is that this huge door opened, and I'm like, oh my goodness, the present moment is so rich with information. And I had no idea, because I was so used to past, present. There's all this, what if this happened and therefore this, and oh my God, I just was not in the present moment.
Yeah. So we're hardwired for that worst case scenario, that catastrophic thinking. Our brains are wired from that, from the caveman days, but we've evolved and we forget that. We only use a small percentage of our brain capacity, and our beautiful frontal lobe that's been developed, our prefrontal cortex, to move through this and to take back control of our own health and healing, to your point, in the present moment. That's where our power lies.
That's right. Yeah.
Yes.
Well, and I think the fourth one, which you've already talked about, but we'll just, underline it again. Where are you sourcing your power? Are you
Mhm.
sourcing it in other people, or are you
Mm,
sourcing it in the innate ability of the body understanding how to heal? This is
right.
really important, right?
Absolutely. And are you being a partner in your healing process, or are you
Mhm.
basically giving your power away to other people, expecting them
Mhm.
to fix it?
Yeah.
Only you know you and know what you need.
Yeah.
And being in the present moment and taking that pause, you can start to connect to what it is that you need in that moment and listen to the messages of your body, your mind, and your spirit.
It's really important, I think, for people as patients and practitioners to pick up on this.
Yeah.
That when I go into a doctor's office, even today with all my knowledge, when I the last time when I broke that vertebra, um, I was in a vulnerable position, and I didn't really know what was happening, and we were still trying to figure out what happened, and it took a minute for us to get to an X-ray actually, because of what I was feeling. I don't respond to chronic to pain the way normal people do because I've had so much of my life. You kind of have to hit me with a Mack truck for me to feel it. It's kind
Mhm.
of a problem.
Mm.
So, but I'm vulnerable in that space, and so I sit in front of my doctor, and it's really important for me to remember that I'm collaborating with him. He's not better than me.
Right.
He
Right.
he may have information that's different,
Right.
but it's
He doesn't
not
have all the answers. Yeah.
it's so I can be very even today, my kind of old patterning is to sit there and give my power away to the doctor because he knows information that I don't. Nowadays, because I know of that tendency and this is my area now and I've just had so much of it, I'll sit there and the doctor will say XYZ, and I'll actually ask myself, is that true? I mean, does that make sense to me? And if and I may not have time in that first 15 minutes because doctor's appointments are very fast, but I'll certainly get back to the nurse if I have a question.
Yeah.
Right? Say, wait a minute, what about this? So I don't necessarily buy everything the doctor says. I respect it, but I'm always checking against my own kind of experience, and it's not being disrespectful. That's not
Completely.
what it is. It's just kind of understanding the perspective that the doctor's coming from, and I just think it's important not to come from a place that's got so much ego in it that the patient feels almost threatened by the information they don't have
Yes.
in their vulnerable state, if that
Right.
makes sense.
Well, and what I always say to people, and I do this myself, whether I am working with a practitioner or I am working with a business coach or working with anybody, you listen, you open yourself to the information, but you also pay attention to how it resonates with you. Where you
Mhm.
can say, "Okay, yep, I'll take this. Nope, that doesn't resonate with me. So I'm not believing that or I'm not taking on that." And it becomes like your interaction, not just with the person that you're interacting with, but with yourself and how that information and that conversation is resonating with you and with your own truth.
Well,
That's
I
important.
understand that, and I want to put in this kind of other piece. If we're in fight or flight when we're sitting in front of a doctor, I don't have access to my intuition. I
True.
don't have access to that.
No.
Um, what I'm asking for is the practitioner to have a little humility
Yes.
and maybe admit that maybe they don't know everything.
Right.
That this is our current understanding of this situation,
Mhm.
right? And coming from that place, it kind of brings you down to like a human instead of a God place, right?
Yes.
So I
Right.
just think I don't have an opportunity to bring this out very often, and I'm
Yes.
going to take advantage of it here because I think I have an audience that might hear me.
Yeah. No, and I will say there are practitioners out there that are absolutely on that level of humility. And then there are some that are like everybody else, stressed. And so their stress stops
Mhm.
them from being able to be present fully with you.
Exactly.
So it's about a conversation.
Mhm.
And if you're not getting what you need from somebody, find somebody that you can get what you need from. So, well, Elizabeth, thank you so much for being a part of this conversation. How can my listeners contact you and get your book, and how can they continue on, especially if they're having chronic pain and want some support?
Thanks so much, Jennifer. It was an honor to be here. Please find me Elizabeth with a hyphen, Kipp, Kipp, two P's like Peter.com, Elizabeth-Kipp.com. You got to put the dash in there because ElizabethKipp.com is a web designer and an amazing photographer. And she is amazing at what she does, but she's not me.
Good disclaimer there.
So you can find everything up on my website, all my social media links, my book, all that stuff, my shop, how to book a session, all of that. My blog, I've got a lot of free information up there, resources you can read. So, go ahead and take a visit over there and come reach out if you feel it resonates with you.
Beautiful. Well, thank you again, Elizabeth, for joining me on this Grounded Awakening podcast. And for all you listeners out there, really start to ground that energy, balancing that with your own inner truth as you reach for the skies and open to your spiritual self. Be well, everyone.